Hello and welcome to the Oakland County Megacast on our family of TV and radio stations. On Civic Center TV and Birmingham Area Municipal Access on Comcast, Channel 15 and AT&T, Channel 99. WBTV, Comcast, Channel 19 and AT&T, Channel 99, the service of the West Bloomfield School District. On our family of radio stations, of course, our flagship 89.3 Lakes FM, live streaming online at lakesfm.com. 88.1 WBFH, the Biff, out of the Bloomfield Hills School District with their station at Bloomfield Hills High School. And WAHS 89.5 Avondale Community Radio, a service of Avondale Schools with engineer Keith Fraley getting us on the air each and every day this week. Been doing a great job over there. We appreciate their partnership getting us into the northern portion of Oakland County as we continue to bring you the news that you need to know about the coronavirus and other big stories now popping up all throughout the Oakland County area and more. We've been following a lot lately, and one crisis has become multiple crises, and we have been working through that constantly at work here at the Megacast, Dave Scott and I. I'm joined by Erica Jones in the studio today with us. She's joining us today. Dave Scott has the day off. He is out on assignment, getting ready for getting all the scoop from northern Michigan as he's up there on business over the weekends. And he'll have the scoop for us on what's going on in Phase 5 up in northern Michigan. That hopefully coming soon to us here in Oakland County and in southeastern Michigan as the My Safe Start plan from the governor's office continues to progress. Making headlines today on the coronavirus front, testing is becoming even more important to our most vulnerable populations. We have a great article here from the Detroit Free Press. Why testing is the best way to fight the pandemic in nursing facilities. As the COVID-19 pandemic hit Michigan, it became really clear it was most unmerciful to our senior citizens and other vulnerable populations. 69% of confirmed COVID-19 cases in the state of Michigan involve individuals who are 70 years of age or older. The Healthcare Association of Michigan, or HCAM, member nursing facilities across the state are in a battle against COVID-19. The average resident in their nursing facilities is 82 years old, and residents are often compromised with multiple medical complications, which of course does not help when you have a disease like COVID-19 that you're also fighting off and your body's systems are occupied otherwise. The data dictates that the fight against the virus must prioritize the protection of residents in nursing facilities. At the onset of the pandemic, nursing facilities remained a low priority for PPE and testing. And of course, with hindsight being 2020, we now have a serious problem in nursing facilities. We'll talk more with Senator Jim Runestad about that. We'll also speak a little bit about the psychological angle on that with Dr. Melanie Schwartz from Viewpoint Psychology coming up later in the show. For though unemployment's also been a huge issue, and we've been discussing that a lot this week, going over the story. Our example, of course, is through Captain Jeff, our producer. His significant other, Lauren Keniston, been having struggles simply just getting her unemployment checks for over 3 months. And now with the fraud issues coming into play, money is tight for a lot of people in the state of Michigan, and that makes it hard to pay your rent, pay your bills. Luckily, and correctly, Governor Gretchen Whitmer on Thursday extended her moratorium, an executive order with the moratorium on residential evictions for non-payment of rent just hours before it was set to expire. This from Paul Egan of the Detroit Free Press. The action ensures, quote, COVID-19 infected individuals and vulnerable populations can isolate in the safety of their homes while continuing to protect incarcerated persons in our prisons, jails, and juvenile detention centers. So the executive order that was signed, the extension, involved both the moratorium on evictions for non-payment of rent, as well as some protections for those in detention centers. Other headlines: Sinai Grace nurses have filed a lawsuit against the hospital, alleging patients died in the hospital because they were short-staffed. Those nurses also said they were terminated for violating the social media rules. That is an article from Bridge MI. That is on our website, civiccentertv.com/coronavirus. All these most recent news stories can be found right there. Another interesting article as we learn more about COVID-19. Multiple research papers across the world have noted higher proportions of blood type A patients being COVID-19 positive and a lower proportion of blood type O patients. The verdict is still out and much research is still to be done. That article from clickondetroit.com. Several months ago, a research paper looking at patients in Wuhan and Shenzhen, China, suggested having type A blood was associated with a higher risk for acquiring the virus than other types, and that type O was at the lowest risk. The paper remains unpublished and has not gone through peer review, according to this article on clickondetroit.com. Other headlines across the state of Michigan. Lynn Henning reports, in a big twist, the Detroit Tigers go for big bats and a better baseball rebuild as they pick a few sluggers in this year's Major League Baseball first-year player draft. Of course, the most notable of those was their number 1 overall pick out of Arizona State, that being infielder Spencer Torkelson. That making headlines, as well as many other stories on the coronavirus front, on the protest front, and much more. And all of that can be found on our website at civiccentertv.com/coronavirus. We update those stories daily and give you the most up-to-date information that you need to know about the coronavirus, as well as other major issues that continue to affect us here in Oakland County, in the state of Michigan, and in the United States as well. Locally, we've had a major battle with COVID-19. Our first responders have had their hands full for the last several months, especially at the beginning of this crisis, and as we fought to flatten the curve. Things are slowing down a little bit now. They're still vigilant. They're still doing their part to help our community prevent the spread of COVID-19, but things a lot more relaxed now than they were definitely at the beginning of this crisis. And joining us now to talk about that and more is West Bloomfield Township Fire Chief Greg Flynn, with us again on the Megacast. Chief Flynn, thank you for being with us.
Tyler, good morning.
Good morning. How are you? How's your team at the FD?
The team is doing well. A little bit of a different venue for me today. I'm a day off for me. So I'm at home here with my COVID buddy, Ruby. But the team at work's doing great. And as you said, things are slowing down. We're seeing those numbers as they report out on the Michigan Department of Human Health and Services page and the Oakland County resource page, that we're trending, continue to trend down. We'll see as testing goes up that there will be some folks that still will come up positive. But again, we're watching hospitalizations too, because many of these folks are going to beat the virus without any intervention from a medical professional, right? So they're going to isolate, quarantine at home, and they're gonna navigate through that in just a few short days, hopefully.
We had our hands full, for sure, at the beginning of this process in Oakland County, one of the highest COVID positive counties in the state of Michigan, right there with Wayne County, especially in the early months of this process. And it definitely took a toll on our first responders, working a lot of hours to keep our communities safe. Just how many hours or how long shifts were our first responders, at least in the fire department, from your knowledge, working in the thick of this process?
So early on, Tyler, when we look back to February and even the first week of March, the team was planning for this. So as vacations were being rescheduled and things were being changed around, we were prepared to make sure that our team was getting the appropriate amount of rest and cycling through the shifts appropriately. So they pretty much stayed on their standard shifts. Now, if there was overtime available, some of our staff did opt to stay at work. So if they had family at home that was at risk, they would just continue to stay at work, because we have a bed and a kitchen and everything for our firefighters. So it's just like it's a home away from home, if you will. And some of our first responders felt that was safer for their families to just keep that distance. So overall, still doing well. Morale, I think, is very positive, and they're very pleased with the success that the residents, by just staying at home and keeping their social distancing, and the things that they've done very well in West Bloomfield, Orchard Lake, Kego, and Sylvan, they've just done a great job.
How critical is it for them to get this rest right now, especially coming off of such a stressful few months with a lot of cases and seeing a lot of things COVID-related in our community? Is this rest important for them, especially if there's a case where we may end up seeing a second wave down the line?
The simple answer is yes, it's important, but the rest is important for all of us. You know, as first responders or as school teachers, as nurses, as the utility workers that are out and continue, all of us need a little bit of a break. And, you know, I especially want to highlight those parents and caregivers for small children that have been completely isolated. And I think we tend to have an approach of, oh, well, they're at home. Well, Danielle and I raised 3 boys, and as a fireman working 24-hour shifts, when I was home with the boys, that can be a long day, but the next day I would go to work. People have been home and isolated for months, and I think it's important that we start looking at how they're going to get some rest, as well as our first responders and those working on the front lines.
It is interesting to think about that, and we will be talking about some of those issues with Melanie Schwartz from Viewpoint Psychology and Wellness later on in the show about the different ways that we should be reducing our stress and helping others that we work with, our colleagues and other people like our friends and our family, because the stresses of COVID-19 and this pandemic are still ongoing, even if the numbers are beginning to dwindle. Being joined by Greg Flynn, the West Bloomfield Township Fire Chief. Also, West Bloomfield Fire Department is our Facebook partner today. We're live with them throughout the show on their Facebook page. Go ahead and shoot them a like, and give us a like as well on Civic Center TV on Facebook. Greg Flynn, continuing on. You talk about reducing stress, and you're talking about providing the rest that's needed to our first responders and to other workers throughout the township at a leadership level. What discussions have you had with your leadership, with your fellow leadership at the fire department, with other emergency services leadership in West Bloomfield, even to the township board level and the supervisor level, to ensure that happens so that we continue to have our local city services and municipal services employees be fresh and be able to do their jobs effectively without stress taking a major toll?
Right. So we refer to it as self-care, and I think you've had some counselors on over the weeks here where we talk about self-care. And Ruby's a big part of my self-care. So when I get home from work, Ruby and I usually hop on the bike, and she runs alongside, and just getting out and finding some time for yourself is going to be an important part of that. Finding some time with the family that's a little bit different than just being in the house. And that's, I think it's, for some folks, it's just a little bit challenging. Each of the calls now we're screening and have been screening throughout is the idea of if they have one symptom, the guys are putting on all their gear, and all of that starts to wear on the first responders, on the nurses, on all the healthcare professionals. And when you look at it, Tyler, you and your team have been coming to work every single day throughout this. And, you guys also need some of that time away. And many businesses are just now starting to open up. They're just coming back to work. And I find that a little bit ironic. And I was talking to your team yesterday. I said, well, I have a day off, and I'm going to be at home. And we wanted to highlight that's a big part of taking the time for yourself. That's what we refer to as self-care.
Yeah, self-care is very important, as you've said, throughout this. And you have to take that time to have some alone time, to de-stress, to get some peace and quiet, because there's been so much going on throughout this entire coronavirus crisis, throughout the pandemic, with everything else going on in the world. There's a lot of noise surrounding us now, and having those moments of peace with your family, with activities that you enjoy, just rest and peace and quiet is absolutely critical.
Right.
So, Chief Flynn, moving on, we've seen lately another thing that's been popping up in our community as businesses reopen and as people emerge from their homes and go back to work and go back to recreational activities. We've also seen some other factors pop up in the form of protests. We've had Black Lives Matter protests in West Bloomfield. There's another one tonight in Keagle Harbor and neighboring communities in our Megacast network of stations. We've had protests there too. From what you've observed and what your colleagues in fire departments throughout Oakland County have observed, what do you see as the COVID safety precaution performance of the protesters, the first responders, as they've been responding to this? Have you seen people out on these protests that have been keeping those precautions well, at least wearing the masks, or are there ways that we can improve as we're going out and we're having our voices be heard, but also maintaining the safety with COVID-19 still very much looming as an issue?
Sure, Tyler. There's a spectrum of compliance with any event, and what I want to compliment is the teams that have the folks that have been planning some of these peaceful gatherings and uh, working and collaborating with our city managers and city officials, township officials, the public safety providers, just to make sure that their voices are heard and they're heard safely. And I think we've seen that. Chief Patton and his team, along with the event coordinators there, did a very peaceful and a wonderful event for them last week. And I'm very confident that the team up in Kego and in the Tri-City area is going to do the exact same thing today. And our residents and those that are visiting our communities, I think are very respectful folks, and they know that when their voices are even louder when they do that. And it's a great opportunity for them to demonstrate some of the things like you've highlighted, a little bit of social distancing, wearing those masks if we're not able to accommodate the social distancing. And finally, Tyler, if they're not feeling well, if they have a sore throat, if they have a cough, if they have a fever, they shouldn't be participating in the event today.
Chief Greg Flynn, thanks again for being with us. It's great to talk to you. Erica Jones here. And, I hate to bring this up because I'd like to think that this will be over soon and we're not going to have a second wave. But on the chance we do see some spikes again in the near future, does the fire department have a set plan as to how that's going to be approached? Are there new strategies that will be put into play that weren't necessarily last time just because we didn't know as much? Or what are you thinking moving forward if we do cross that bridge?
Hi, Erica. That's a great question. And thanks for asking that, because I think it's very important that the community knows that we're positioned much better today than we were yesterday, and then what we were weeks ago, and then months ago. We continue to learn more about COVID and its transmission. We continue to learn more about the treatments, and we continue to see the supply chain for PPE increase, and the speed at which we're seeing things. And what we're also recognizing is how innovative folks are within our community. The outpouring of donations from 3D printers and things that we could use to keep our team safe so that we can safely help those in our community has been unbelievable. So to answer your question, yes, there's a plan. Yes, we're ready. And yes, we have a community that's better equipped to respond to a second wave. And that's why many of my colleagues are confident that when that second wave hits, because it will hit to some degree, that it is going to be something that we will be able to manage a little bit, much easier, not a little bit easier, but much easier than we did back in those first weeks of March.
Joining us on the Oakland County Megacast is Chief Greg Flynn of the West Bloomfield Fire Department, talking COVID-19, talking about the safety precautions that we've been employing as people come back out of their homes. And on that note, Chief Flynn, businesses are reopening. We had the restaurants, we had retail stores reopen throughout West Bloomfield, throughout the greater area, and Oakland County as well this week. Next week, we're going to see hair salons and barbershops and the like, some of those personal services, as they're called, at the state level, reopen throughout the area. As far as their performance so far, from what your team has seen, from what discussions maybe you've had and other emergency services have had with these businesses, how are they doing so far, employing those social distancing measures and encouraging other safety precautions and training their staff as they bring people back into their stores?
As I have the opportunity to talk to some of our local business owners and or friends of mine that are in the business, colleagues, other firefighters that have spouses that are in that industry, they're anxious to get back to work, and they're anxious to do it right. And I know Lieutenant Dennis Cotton's wife, Julie, has a salon. And what a great combination where I think Dennis plays a little bit of an advisory role and can give her some coaching on that. And I think she takes that and improves upon it, like other salons and barber shops and folks that provide those types of services. They want to do it right. We've got to keep in mind that they don't want their clients sick. That doesn't help their business model if they're not doing things well. A restaurant doesn't want to be known for being the place that was the start of a second wave. And that's the kind of confidence I think we need to have in our local business owners. Oakland County, through the help of the Township, distributed boxes to local businesses that they could have extra masks and hand sanitizer, and really a game plan for opening up. So the support is there, the desire is there from our business owners, and the desire is there from their clients that want to get back in there. And not everybody can cut their hair quite as easily as the fire chief, right? So it's a good thing to see them opening up and doing such a good job. And I do have to compliment Mrs. Flynn for this, because she takes care of all the Flynn boys.
She did a very nice job, by the way. She did.
Thanks.
So Chief Greg Flynn, West Bloomfield Fire Chief, with us on the Oakland County Megacast. Just a couple more minutes with you. Any lasting advice going forward from this point that you have for residents in our communities, for the businesses that are planning to reopen and are getting ready for that whole process? Any further advice at this point that you can give that would be helpful for them right now?
I think the biggest thing, and you've heard this and seen this on some of the social media posts, but it's to be kind. There are people with all different thresholds for how this virus has impacted them. Tyler, I've been out in the community since day one, and doing all of that with precautions, and clearly doing more of it as time has gone by. I'm very pleased to announce my COVID test has come back negative. My antibody test that I recently had has come back negative. And I share that with you because I'm doing the exact same things that we're recommending to our residents to do. I'm washing my hands frequently. When I meet someone new, I say hello, have a warm greeting. I'm not shaking hands on a regular basis. Those are the types of things that are going to set us up for success. We don't need to be afraid of the coronavirus. We don't need to be afraid. Viruses have been around forever. What we need to be is informed. And when we're informed and we understand how the virus is transmitted, we can easily combat this and we can easily reduce our risk. Because we know once the virus does infect folks, that there are some people that are very, very susceptible to the becoming very symptomatic, and a small percentage being hospitalized. So that's the advice. Re-engage in the community in a safe manner with confidence and compassion for those to do the right thing, and compassion for those around you that maybe aren't in the same place that you are. There are some that really want to get back out there. They don't want to wear a mask. They don't want to do this. And you're sending a message of a little bit of disrespect to your neighbors, because it doesn't take much effort to put a face covering on, and we can do that. And then we can all move forward with confidence and bring our communities back to full operation, if you will.
Chief Greg Flynn of the West Bloomfield Fire Department with us on the show today on the Megacast. One last question for you. You've been out a lot. You've been working really hard throughout this entire pandemic in our community, keeping people informed, keeping the fire department's affairs and orders, working with the Township and the Emergency Operations Center for an effective response. But I got to ask, how's Ruby been doing through all this?
So, I think you'll find most of the pets have probably responded very positively to this. Everybody's home all day with Ruby. We actually took Ruby's crate and collapsed it down and put it away, because there's always somebody home. The boys she's getting more walks, more attention, and more visitors walking by. We're a corner lot, and so she has plenty of people walking by on all sides and doing great. And I will compliment the vets, the veterinarians that have kept care going and making sure that prescriptions for our furry friends, that all of that continues, and they've done an excellent job with that. They too, like all of us in different industries, have adapted to COVID. We're not afraid of it. We're responding to it in an informed manner with compassion to everybody, even the four-legged or two-winged or scaled friends that we might have at home.
All right, thank you very much. We have the top dog from the West Bloomfield Fire Department, and we also have Chief Flynn with us as well. Chief Flynn, Ruby, thank you both for joining us today on the Megacast.
All right, Tyler, Erica, thanks.
Thank you. Chief Greg Flynn from the West Bloomfield Fire Department. The Fire Department, also our Facebook partner today on the Oakland County Megacast. It is a beautiful Friday in Greater West Bloomfield in Oakland County. We're going to continue on with more of the Megacast in just a few minutes. Coming up, our other guests today, Senator Jim Runestad from Michigan's 15th District, Mayor Ethan Baker from the city of Troy, And in the second half of the show, second hour, we'll be joined by Dr. Melanie Schwartz from Viewpoint Psychology and Wellness and Sabrina Cronin, the principal founder of the Cronin Law Firm. That and more coming up on the Oakland County Megacast on our family of stations in just a couple of minutes.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
The Oakland County Megacast continues on our family of TV and radio stations on Birmingham area Municipal Access and Civic Center TV in West Bloomfield, Keego Harbor, Orchard Lake, Sylvan Lake, Birmingham, Bingham Farms, Beverly Hills, and Franklin. On 89.3 Lakes FM and lakesfm.com. On 88.1 WBFH, The Biff, and WAHS 89.5 Avondale Community Radio. We're also joined today via Facebook Live by the West Bloomfield Fire Department, and we thank them and their thousands of followers and likes for joining us today on the Oakland County Megacast, as they have so many times before. Welcome back. I'm Tyler Kieft alongside Erica Jones in our Green Media Center studios, continuing to talk about all the latest coronavirus information and other big information and news that has been taken over here in Oakland County and the state of Michigan over the last several weeks. We have a lot of big stories up. Obviously, the coronavirus, COVID-19, still a big issue here in Oakland County and the state of Michigan, but we also have other issues. Unemployment. We have the Black Lives Matter protests, and police reform has become a hot topic issue in the state of Michigan, as well as the treatment of patients and visitors, and in particular families of those in nursing homes. And to talk about all of those issues and more, we're joined now by our next guest, a very special guest with us, the senator from Michigan's 15th District. It is Jim Runestad with us again on the Oakland County Megacast. Senator Runestad, thank you for being with us.
Good morning. Thank you for having me.
Good to have you with us. How have you been? How's your staff and colleagues? How are they holding up?
The staff are, I'll frankly indicate, are under a lot of duress, and the reason for that is that we've taken over 1,000 calls on the unemployment insurance program, and I was just talking to them yesterday, and it's very hard to be on the phone with somebody who says they haven't received a check since March and have no money and can't pay their bills and literally can't even get food. So we're referring them to food banks or the Oakland Livingston Human Resource Center to be able to try to even get food. When you deal with people who are in absolute despair and turmoil, call after call, they are really doing a phenomenal job of doing everything they can do to get these applications processed, but they feel impotent in many regards because we're at the mercy of the system, and it's just been a mess.
It has been a mess, and we have a personal touch to this story as well. Lauren Keniston, who's the significant other of our producer Jeff on this show, she has been unemployed. She applied for unemployment in March. She has not received a single check, and She is one of those, and she's currently now also tackling the issue of the fraud cases, the 340,000 reported cases of fraudulent entries of people's information into the unemployment insurance agency's systems. And we spoke earlier on in the week with an expert from the University of Michigan who had spoke about mounting technological issues even before this with their Midas system over there. Earlier on in the week, we read an article from Bridge, Michigan about this issue when it was first reported this week, and they reported only 600 staffers are working on the fraud issue right now, specifically from the unemployment agency. Is that enough people for these 340,000 cases? And what maybe is the state doing to help put more people on this major issue that's affecting hundreds of thousands of people in our state?
Well, I can tell you what my office has been doing, what I've been doing, and what the legislature has been doing is from the beginning is advocating if you're furloughing state employees, number one, the state employees should not go to the front of the line, which is what happened. They didn't have to go through this process. They were able to leapfrog everybody else. That shouldn't happen. Also, during the early stages of the shutdown, there was a lot of employees that were working from home, and frankly, it wasn't a lot of work to do. They all should have been assigned to the unemployment system, getting trained, taking phone calls like our offices have been doing. That all should have been done from the get-go. So that's some areas of frustration. If there's any employees still today that are not putting in a full day's work, which every one of them should be, but if there's not, they need to be assigned to the unemployment system to be able to facilitate getting everything moving at a faster pace.
Do you believe at the state level that this is being taken as seriously as it should be from your colleagues, from the governor level, from the state agencies? Is this a top priority right now? Is it being treated as such?
Well, it should be, and I hope that it is. I noticed in one of the recent articles that Dan Gilbert and some other IT organizations had offered their assistance, and that was turned down, and I'm not sure why. If it were my job to make sure that people are getting the checks they need to survive, that would be the top priority. I would say, come on in and let's work together. What can we do to get this system more effective, moving faster? I'd assigned every employee that I possibly could who was not fully engaged elsewhere to be working on this, because this isn't an insignificant, inconsequential thing if you haven't received a check for months. And the food banks are overburdened as it is. So I've asked my staff, for every person that we have referred to an agency like a food bank, do a follow-up call and see, are they getting what they need to get over this hump? And if they are not, let's get on to something else and start raising hell, because we cannot have people who cannot have food. I mean, you get into depression, suicide. So we are going to do whatever we have to do from an advocacy standpoint, from our office and myself personally, to do what we can do to make sure these people are getting their bare minimum they've got to have right now.
That's good to hear. And we heard this similar sentiments earlier on in the week from Representative Cheryl Kennedy from the 48th District. She's a Democrat. You're a Republican. This is an issue that it shouldn't be political. People need to get their checks one way or another. And limiting that over a course of 3 months or not getting them checks at all, it's completely unacceptable in our state. So either in your caucus, or if you've heard from your colleagues on the other side of the aisle, or if there's something bipartisan in the works, is there some sort of legislation or some sort of action that's being taken at the legislative level to address this issue right now?
I know there's an oversight committee that I'm not sure if I'm not on that committee, so I don't have their agenda in front of me, but whether they've already had that or they're going to have that very soon, we're going to be bringing in the department. We're going to bring in all the stakeholders and figure out what went wrong and what can we be doing right now. So that is something that the legislature is working on in a fast track.
It's good to hear, and that needs to be done as soon as possible. We got 340 people whose accounts have been frozen due to fraud. And in an article early on this week, Jeff Donofrio, the director of the Department of Labor and Economic Opportunity, said there was, quote, a significant amount of fraud in new applications. He also said, quote, unfortunately, because of this criminal activity, some of these folks are experiencing additional delays, and acknowledged the unemployment fraud is an emerging national issue. But these are 340,000 people, and there's 2 million plus people that are on unemployment. So from your office, you talk about raising hell or bringing it to the next level and escalating this issue as your constituents call in and call in and call in. These are thousands of people. Your team can only do so much. Are you seeing that this is a common thing amongst a lot of your colleagues? And do you believe that the powers that be in the Unemployment Insurance Agency at the Department of Labor and Economic Opportunity are listening and responding properly?
The department has been very difficult for us to get in touch with. Obviously, they're snowed under, but I would I would urge the governor on 2 issues to make it the number one priority. First off is this one. I would like the governor to have a press conference and say, we know there's issues, we're working on them. It is our top priority, and here's what we're doing. We're devoting all the resources, every spare person we can get to address this. We're having them work on this. We're taking so many calls coming in. It's hard for us to get back to the other people. I would like any employee at the state who isn't fully engaged to be making these phone calls as well, so that people aren't just saying, okay, we put your application in and leave it at that, and then the person is in absolute despair. They need follow-up phone calls. Here's where things are at. So all the resources of the state need to be devoted to that. The other issue that I think absolutely has to be dealt with is the nursing home issue. Those are the 2 issues that create more despair right now than any others. These are the 2 issues that could lead to suicides, family breakups. It could be foreclosures in the case of not receiving money, or repossessing your car. Now you are really in behind the 8 ball. So those 2 issues, I would love for the governor to say publicly, this is our top priority and this is what we're doing.
Okay. So I know you said that a lot of your staff have been getting these phone calls from people in complete despair who you have to refer to food banks and stuff, can't even afford to feed their families. Has this had a large, emotional burden on your staff or you personally in your everyday life? Because, it's obviously a terrible, hard situation, but how has that made you guys feel?
When this first broke for about maybe 3 weeks, about 2 weeks, it didn't seem like the concern was that bad. About the 3rd to 4th week, seemed like everyone had my cell phone. I don't know how they had it, but everyone had my cell phone, and it was ringing. I was taking calls, texts, and emails personally because they were coming into all my personal contact. People that felt that an employer was having their loved one go in when they didn't feel safe, or a business owner that said if this continues, they literally don't think that they can make it just because of the amount of money they're paying on, say, a lease payment or fixed costs, and they don't have cash flow coming through. And I remember putting on Facebook on Saturday that it was my most difficult day in office in 5 years, five and a half years, listening to these people, because you start internalizing their situation. You start getting emotionally, feeling exactly what they're feeling. And then you get off the phone and it's another one, and it's another one. And it starts draining you, and you feel like, how can I help these people? What can I do? And there's another call and another call. And then over time, it transitioned more to the office. And I talked to them yesterday, and I said, "What are you feeling? What are you seeing? What's happening?" And every one of my staff is working primarily on the unemployment insurance calls. That's all they're doing. Not entirely, but every spare minute, all of them are doing that. And all of them conveyed the same thing that I felt that Saturday. They said it is so emotionally difficult because they're working, they have a paycheck, my staff, but they're talking to people who haven't had a check in months and months, and they are saying we need food. And I've told the staff, if you have individuals who are in need of food, I want you to do a follow-up call to where you referred them, and I want you to do a follow-up call to that individual. I want to make sure they're getting food. If they're not getting food, you let me know, because we're going to make sure that they do.
We're speaking with Senator Jim Runestad from Michigan's 15th District on the Oakland County Megacast on our family of stations throughout the Oakland County area, as well as online on Facebook Live via the West Bloomfield Fire Department's Facebook page. Senator Runestad, before this pandemic, we've known you for a while. We've talked to you a lot on our station and our many shows here, and a group of our population that you've always put a lot of effort into protecting has been our senior population. You've passed legislation in the past, or been on the forefront of legislation in the past to protect our senior population. During this COVID-19 pandemic, a lot of nursing homes began to take on COVID-19 patients, and these nursing home patients that are there, they're often having mounting other medical issues that could make COVID-19 being in the same facility that much more dangerous, with a lot of those patients being in a vulnerable population of 70 years of age or older, as we read earlier on in our headlines. Your thoughts on the decision at the state level to have COVID-19 patients put into nursing homes with other patients as well?
I would say that from what I understand, there was 4 states that permitted, I hear different stories. Some say that was the call that they were supposed to take, required to take the COVID patients in with non-COVID patients in a nursing home. From one of the things I'd heard and saw one of the stories in Michigan is the governor's office said no, that they were permitted to. But it doesn't really make a difference to me whether they were permitted to or they were required to, because the nursing homes are not capable of handling that kind of a situation. You need to have a separate ventilation system. This is the kind of thing that we should have been dealing with by when we set up, like Suburban Showcase had, I believe it was 500,000 that they were prepared to take. If we even set up, say, 1,000 or 500 or 200 beds for nursing home patients that were COVID infected, that we could have got there, so they're not in with the healthier population. This has caused an explosion in the states that put these infected patients in with the healthy patients, and it spreads the disease. It's just how it works. And it's devastating to think that your spouse had a stroke, they went to a nursing home completely healthy, they put a infected COVID-infected patient in with your spouse, and now they're infected and they die. And this is the kind of thing that was happening. So that absolutely should be prohibited. We should do everything that we can do to look out for these vulnerable people, to have the terror that if you're going into a nursing home, could you be put in with a patient who has the coronavirus? If your family member is in there and you are in despair, you can't see them because right now they're not able to go in and see them, but they could be put in or have an infected individual put in with them. It just creates absolute terror for the patients and the patient families. So I will do anything I can do to make sure that there's a policy in place that if we have to open up and pay for a nursing home only that has infected patients, so that we're not infecting the healthier patients with the virus, whatever it takes to do, I think we ought to be doing. The other thing I definitely want to mention, because I know we're probably limited on time, is that I was very, very proud of my colleagues yesterday. Yesterday, we passed out of the Health Policy Committee the bill that requires a nursing home to allow the patient's family to put in a video camera. Prior to this bill's passage, the nursing homes could say, and almost all of them do say, no, there's no cameras coming in. Now, a lot of families put them in clandestinely, hidden cameras, but if they capture abuse in that situation, in most cases, it's not admissible in court. So you can go online and literally scroll through hundreds and hundreds and hundreds of videotapes of horrific abuse by either one patient abusing another or staff abusing a patient. Violent, horrific abuses. But most of those times that's not admissible because it was considered an illegal taping because it was not lawfully done. So this bill says that if the family member and the patient wants to put in a camera, they control the camera. They would have to get the permission of anyone else, any other patients that are in the room. In order to do that, they have to post that they have the camera in there. And there's a whole bunch of procedures to protect privacy. If they need to close the curtain and do a private procedure, those type of things, all of that is included in the bill. So it passed unanimously out of Health Policy Committee yesterday. I believe it's going to go to the floor, pass there, and then go to the House, and at some point become law, so that every patient in Michigan that wants to have a videotape controlled by their loved ones will be able to do it.
Well, congratulations to you on that. I know you've been working on that for a while now, and it's good that that's moving along. You mentioned earlier on when talking about the nursing home issue, visitation. Visitation's been a huge issue. We talked earlier on in the week with Michigan's long-term care ombudsman, Sally Punk, who had said that people are going and talking to their loved ones at the window, and there's been some construction companies that have come out and put up platforms so people can go to the second and third floors and talk to their loved ones through the window, but they haven't been able to go inside the physical facility into their loved one's room and confide with them and be there with them in person and embrace them, as we've seen with other patients now being able to do so in other medical facilities like hospitals. We also talked with Eric Wallace from Henry Ford West Bloomfield Hospital yesterday on the program about their new visitation standards and the safety precautions that they've put in place. Are we at the point now where nursing homes should be opening up their doors to at least one visitor, specifically like we know Henry Ford West Bloomfield Hospital is doing one visitor per patient? Should nursing homes be opening up visitation from families at this point? And what maybe are you working on or other colleagues in the legislature working on to make that happen?
That is something I will have to take a closer look at, but it would seem to me right now with the declining numbers of infected cases, and if an individual, one person came in, the temperature was checked, they were wearing a good mask that both, is that N9, I believe is the mask. It would seem that that would be something that could be done safely, and I'm glad you raised it with me because but I've been so busy. It's one of the things I wanted to check into, and I'll be checking into that this week, because the idea that the nursing home could bring in a COVID infected patient right next to your loved one, and that's okay, but you who are the family member coming in one at a time with a mask, checked your temperature, coming in and giving some love to your loved one, that's not safe. So I mean, some of the things we do from a logic standpoint just don't make sense. And like I said, I'm glad you raised that with me again, because that's something that I intended to do this week, but I had a very busy week in terms of legislation. But if there's any way safely, and I'll talk to the governor's office about this, that we can allow a loved one to go in safely, wear gloves if they have to. I'm sure if they had to hug them even with gloves or put their hand on their shoulder and say, I love you, that if there's any way to do that safely, that is what we need to be doing. Because if you're in a nursing home, my mom was in a nursing home for a year and a half. If I didn't see her for 3 months, I think she would have died, because it was us coming in to spend time with her that made her day. The rest of her day was just, she was in a nursing home. She was debilitated and she was depressed. But we would come into that room and my God, her face would light up and she was just as ecstatic as can be. To not allow that means these people are going to be dying. So whatever it takes, if we can do it in a safe manner, let's make that happen.
Jim Runestad, the state senator from Michigan's 15th district, with us on the Oakland County Megacast. And it's good to hear that you're on this issue and you're on a lot of other issues, Senator Runestad. And maybe we can get our producers to get you in contact with long-term care ombudsman Sally Pung to get you two together and you two to exchange thoughts and ideas and maybe move the needle forward on this. Senator Runestad, just a couple more minutes before I got to let you go. Anything else that you're working on right now that you'd like to talk about, or any other issues that maybe we haven't touched on in today's interview?
Yes, I want to leave you with this. Yesterday was one of my most exciting days in office in 5.5 years, because the nursing home video camera bill came out unanimously out of the health policy, but something I've been working on since I got elected, and that is there's a lot of law enforcement prosecutors that believe your electronic data and communications is not private, that they ought to be able to come into your phone, your computer, research anything, look, read anything they want, use what are called cell phone simulators to listen in on your conversations. Literally, departments across the country have been doing this. So my resolution passed unanimously yesterday that said it's going to go in the Michigan Constitution, that it requires a warrant to access a person's electronic data and communications. So from now on, none of that is going to be happening, because it passed unanimously yesterday off the floor of the Senate. It's going to go to the House. The last 2 cycles, I got it passed unanimously, except for one vote, twice in the House. So it should pass unanimously there, go to the vote of the people. I believe it'll pass over 80%. From that point on, everyone is going to be assured that there will not be this kind of surveillance from the feds, because the feds are going to have to come to the state to do this kind of stuff, or from any state authorities to be able to access your information, because it's going to be illegal.
Senator Jim Runestad from Michigan's 15th District with us on the Oakland County Megacast. Thank you very much for joining us today, Senator.
Thank you for having me.
Always a pleasure. Jim Runestad from Michigan's 15th senatorial district in the state of Michigan, talking to us about a number of issues. And like Dave says every day on the show, and like I also say on the show as well, we're not a political show. We don't take one side or another, but the issue of unemployment, the issue of keeping the patients in our nursing homes and their families safe and happy, and especially in these stressful times, is absolutely critical. And it's not political, and these are tough issues that are going to take tough conversations in order to solve. We're going to be back in just a couple of minutes. We'll be joined next by the mayor of the city of Troy, Ethan Baker. He'll talk to us about the recent protest that happened in the city of Troy and his police department's response, as well as the city's plans for reopening and their plans to work with the business community to hopefully make a smooth transition back to some semblance of regular business as we enter this new normal. I'm Tyler Keefe alongside Erica Jones. You're watching and listening to the Megacast, and we'll be back very shortly.
Michigan, we still need to stay careful, because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/contain-COVID. A message from the Michigan Department of Health and Human Services.
The Oakland County Megacast continues on our family of television and radio outlets throughout Oakland County. Tyler Keefe alongside Erica Jones on Civic Center TV and Birmingham Area Municipal Access. On 89.3 Lakes FM and lakesfm.com. On 88.1 WBFH, The Biff. And on WAHS 89.5 Avondale Community Radio, that a service of Avondale Schools up in Auburn Hills. Lots going on in the Oakland County area right now regarding the coronavirus, regarding a number of other issues, and our municipalities are also heavily affected by all of these issues. And joining us now on the Oakland County Megacast, he is the mayor of the city of Troy, Ethan Baker, with us on the show. Mayor Baker, thank you for being with us.
Oh, Tyler, Erica, thanks for having me. I appreciate it.
Always a pleasure. How are you? How's the city staff been doing during all of this?
We're doing pretty well. Same complaints as everybody that we've gone through over the past several months at this point, and the same issues that have cropped up. And we spent a lot of time taking, one day at a time as everything changed. But we're in a good rhythm right now, and now we're trying to adjust going back to getting things back a little more to normal. So now we're transitioning back.
Well, that's good to hear. How have your city's operations been altered during this pandemic? And is there any plan now in place or already in motion to return to some semblance of normalcy?
Yeah, well, our city hall's been shut down pretty much since March, the end of March, and we've transitioned to most of our employees working from home. There's been some more back and forth into the office here and there, and we're seeing residents on an appointment-only basis right now at a city hall. But our community center, our library have been closed. But the essential work of a city still had to go on, and so we still were. Our Department of Public Works was still handling all of our streets and water and sewer issues and the trash, and that all happened consistently throughout the pandemic time. And our city employees have really transitioned to working from home primarily and have done a really good job at it. Now we face the, how do we get back into normal business? We've done a lot of renovations at City Hall with plexiglass and decals marking space for social distancing purposes. And we don't have a firm date yet when we're opening back up at City Hall or the community center, but we're figuring that out now.
That's good to hear. We have some other municipalities in the local area who have made those plans and or are in the process as well. So it seems like a lot of Oakland County is either already reopened partially or in full with social distancing and other safety measures in place, or are planning to do so very soon. Mayor Baker from the city of Troy with us on the Megacast. Businesses also reopening. We saw restaurants, bars, and some retail reopen this week and late last week. Personal services, particularly those hair salons and barbershops that everyone's been clamoring to get to for a haircut for a while, are going to be reopening. Are there any new challenges that these reopenings, with COVID still very much in mind, have presented to the city?
Sure. Troy has become known for its restaurants that we've had. We've added a lot of new restaurants on the Big Beaver corridor and throughout the city over the past few years, and trying to figure out now, they've been shut down, reopened this week at 50% capacity. That's a challenge for a lot of these restaurants who can't necessarily operate and be profitable at that level. But I've visited several of them this week, kind of in an official capacity and also with my wife to eat. And they're doing a good job. Definitely keeping the disinfecting aspect going, the masks, the social distancing in the restaurants. That's been it seems to me the restaurants I've seen, they're doing a really a phenomenal job of making that work. The question will be, of course, how long do they have to do those techniques before they can open up more? We've got not a lot of outdoor dining in Troy, which is tough because if you can have outdoor dining, it seems people are more willing to go there. But we do have some restaurants that have expanded their patio areas, and that seems to make a difference. I went to Yard House, for example, the other day, and no one was sitting inside. Everybody was sitting outside. So it seems to me people are more willing to eat outdoors than go sit in a restaurant right now.
So, Mayor Ethan Baker, City of Troy, I know we've talked about restaurants now. How's the mall doing? I mean, what's more important?
Right?
Yeah, I actually got to go the other day, and I noticed a lot of stores are still closed. But have you been able to make your way out to Somerset yet? And what are your thoughts on what's going on there?
Listen, Somerset's a big part of our city. Some people call it the downtown of Troy because it draws people in from all over the state. I have been. They did a soft opening back on when the governor's order initially changed to only allow 10 customers per store, and they did it for a few days, then they closed down again because there were some protests in Troy that they were concerned about. And then they reopened back up with a new governor's order, and I went again. And yeah, a lot of stores are definitely not open yet. They're still trying to figure out the best way to do their job to keep everybody safe, both their employees and also the customers. But, I think every day more stores are opening and more people are going. And Somerset's done an excellent job of, they provide masks for guests if they don't have them. They're keeping things very clean. They're moving through. And I know the people they've got employed there are really on top of it. So Somerset's a big part of our community and our city, and it's definitely slowly ramping back up. And last I heard from them is they expect, 10 stores every day or two to reopen, and we're getting there.
Mayor Ethan Baker of the City of Troy with us on the Oakland County Megacast on our family of stations. We'll take a quick pause to identify our radio stations and keep it all legal. You're listening to 89.3 WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, and WAHS 89 and WAHS Auburn Hills. That's WAHS 89.5 Avondale Community Radio. You're also watching us on Civic Center TV and on Birmingham Area Municipal Access and on Facebook Live from the West Bloomfield Fire Department's Facebook page. Mayor Ethan Baker, a lot of other cities and municipalities in the Oakland County area, particularly I know this past week, last week, the Keego Harbor Planning Commission had discussions about this. This Monday, West Bloomfield's Township Board had discussions about this, and Birmingham's already put measures in place to help local businesses like shops, retail, and even some restaurants to help expand their space, maybe a little bit outdoors on the sidewalks or in the parking areas to give them that extra space so that they can limit the 50% capacity indoors, but bring in as much business as possible and have a strong restart as they come out of this COVID-19 crisis slowly but surely. Any plans on the like in the city of Troy?
Well, we're taking each request on a case-by-case basis at this point. Sedona Tap House, for example, on Big Beaver, they've requested to go into our city sidewalk, which we're allowed to do with the city's permission. So they've expanded their patio service, and I talked to the owner, Marty Nolenberg, just yesterday, and he said that their patio's been full. So it's been a good thing for them. A lot of our restaurants are not on streets like Birmingham is, or some of the more traditional Main Street downtown type atmosphere. So it's a little bit of a different equation for us. We do have a ton of parking lots in Troy, plenty of parking. It's always free in Troy. But our restaurants haven't really been requesting that usage. We're more than willing to consider each request and to come up with something that works because we want our restaurants to thrive and we want our residents to have a place to go eat and enjoy life a little bit like normal. But we're not really in the position where we need to do anything formal at the city council level to pass an ordinance. We can handle everything administratively at this point.
Mayor Ethan Baker from the city of Troy. We recently, and you mentioned this earlier on in our interview, saw the Black Lives Matter movement make its way to the city of Troy. It was one of the first suburban municipalities in the Metro Detroit area that partook in these protests. They were very peaceful. They were handled exceptionally well by the police department, by the protest organizers, and the Troy PD showed great care and solidarity and communication with the folks in that local protest in the wake of the death of George Floyd. And talked on issues of racial disparity towards black people and people of color. Your thoughts on the protest leadership, and the response from the community?
Sure. Well, we had two peaceful protests in Troy last week on a Monday and a Friday. It was quite a week for the city of Troy, a community that's not used to really that kind of civic engagement on that level. But we're very blessed to have a police department that cares greatly about our community and fighting racial injustice, and they're against police brutality themselves. When we worked together with the organizers of these protests so that it could be a peaceful partnership, and that really made the difference and allowed it to be that. You saw the police officers and the Troy Police Department shutting down Big Beaver and escorting these protesters down so they could walk and not disrupt things in an inappropriate way. And it was really meaningful and impactful, I think, for our community. The two protests we had were a little bit different. Mondays wasn't quite such a homegrown protest, whereas Fridays was organized by a former Troy Athens High graduate who's a freshman in college now, and she came back to her hometown to do this, and there was a ton of local Troy residents that were out participating. I was there with my wife, actually. It was important for me to see what was happening on the streets of our city and to show our solidarity with the police department, with the protesters, with the movement in general. Troy's a diverse city, and I have no shame in saying that the Black and brown lives of our city absolutely do matter. So it was important for me to be there and see it. And I think it made Troy shine to see our great community support and taking a stand of solidarity.
There's been a lot of talk also recently about quote unquote defund the police and other translations that goes to reforming the role of the police or increasing the role of other community initiatives and community policing situations in order to help reduce the police brutality, but also to help encourage some reforms that help people in need that the police maybe are not ready to work with, or not best equipped to work with in the sense of social work and mental health professionals and so on. Has there been any discussions at the city council level in Troy or between yourself and the leadership in the police department about changes that may be made in Troy, or additions or modifications that may be made to the systems that be in Troy to address these issues?
Well, let me say, the city of Troy is not going to defund their police department. I'll tell you that right out. Our police department, our emphasis on public safety is a huge part of our city's success. We've been the safest city in Michigan several times, and we really pride ourselves on our strong public safety ability in the city of Troy. Obviously, you look at throughout the country, and there's different urban areas and different police departments that have issues, and a lot of them what they need are the reforms that the Troy Police Department already has. We are extremely forward thinking when it comes to training, background checks for our hiring, how we use of force procedures. And right away when the George Floyd protest started and the issue became in the national interest, we requested information from our police department on their use of force procedures, their community policing procedures, their hiring and training of the police officers, because we wanted to see and know, what we had here in Troy. And we've been provided a preliminary report, which is public information. We're reviewing that as we go through. There's 6 council members and myself as the mayor. We're looking at those things and seeing what needs to be done. But it turns out that a lot of what other communities the reforms they're looking for are things that the city of Troy already does. You hear a lot about Camden, New Jersey, and how they disbanded their police department and rebuilt it. Well, what they rebuilt it to is what Troy is already doing. So we're fortunate to be ahead of the curve in a lot of that. Doesn't mean there's always not time to look over things and look for reform where necessary, but we're working really hard to go through that information now and see what tweaks we can make if we need to. And I'm very confident in our Troy Police Department, and we are a model, I think, in the community or in the region, if not in the state. So I'm feeling good about where we are with our police department, but we'll always look and see where we can make adjustments if necessary.
Joined by the mayor of the city of Troy, Ethan Baker, on the Oakland County Megacast on a family of stations. Just another couple minutes with you, Mayor. Anything else that we haven't touched on that you'd like to speak about, or any other things you'd like to bring up about the city of Troy?
Oh, I think, listen, we've got, like I said, we've got a lot of restaurants here. We've got a lot of small businesses that are back open for business and can use your patronage. Obviously, that's no surprise that there are, the population's a little bit split on how they feel about COVID-19 at this point and getting back into the economy and getting back out into their normal lives. And, if you're too afraid to go out and use a restaurant and dining, I respect that completely, but it doesn't mean you can't get carry out from them. On the flip side, if you're ready to get out and dine, please come to Troy. We'd love to have you. We are same with our retail, our shopping. We're prepared to handle what needs to happen. I'm extremely proud. We've got Troy Beaumont here and a lot of healthcare workers in our city, in our community. And I've been really, really amazed by the outpouring of support in our community for those healthcare heroes and for our frontline responders. And so I try every chance I can to talk about how wonderful they are here in the city of Troy, our volunteers, our healthcare heroes themselves. And we're a great community. And I think it shows in these times of crisis when you see people band together like they have.
Mr. Mayor, thank you very much for being with us today.
Absolutely. Thank you for having me, and I appreciate it very much.
Absolutely. You have a good weekend. Mayor Ethan Baker with us on the Oakland County Megacast on our family of stations, joining us to talk about a number of different issues in the city of Troy, businesses reopening, the recent protests, and so on. We'll have more on the Oakland County Megacast coming up in just a couple of minutes. We spoke earlier on in the show with Chief Greg Flynn about the mental health impact of working so many hours and seeing everything that you saw as a first responder earlier on in this COVID-19 crisis as we were working to flatten the curve. We also spoke with Jim Runestad just a few minutes ago as well about the toll that the mental health the mental health toll that the unemployment crisis has been taking on people throughout the state of Michigan. Next up on the show, we'll have Dr. Melanie Schwartz from Viewpoint Psychology and Wellness with us on the Oakland County Megacast to talk about how do we navigate that as a community, and how do we navigate that with those that we love and those that we work with in our lives as they maybe are facing some of these major issues. That and more coming up on the Oakland County Megacast after this very short break.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hi, I'm Dr. Jonae Caldoon. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft. We're on 89.3 Lakes FM, on 88.1 WBFH, The Biff, on WAHS 89.5 Avondale Community Radio, as well as on our family of television stations, Birmingham Area Municipal Access, in Birmingham, Bingham Farms, Beverly Hills, and Franklin, and on Civic Center TV, our flagship out of West Bloomfield, Kegel Harbor, Orchard Lake, and Sylvan Lake, that a service of the Greater West Bloomfield Cable Communications Commission. You can also watch us online on civiccentertv.com and go to civiccentertv.com/megacast for full episodes, interviews, and clips from today's and other episodes of the Oakland County Megacast. We're also on the Facebook page of the West Bloomfield Fire Department. They are our Facebook partner for today's program, and them with their thousands of followers and likes. We thank them for joining us today on the show, as they have many times before. Lots of issues right now in the state of Michigan, in Oakland County. Unemployment, a key issue. The coronavirus, still very much a lingering overall issue, and we have other issues as well, such as social issues coming up back into the fray and making some progress. All of this can cause a lot of stress on people and bring a slew of different mental health issues to the forefront. And to talk about how we navigate that, we're joined again by Melanie Schwartz, Dr. Melanie Schwartz from Viewpoint Psychology and Wellness. Dr. Schwartz, thank you for being with us.
Of course. Thank you.
So how have you been? It's been a little while since we've had you on last.
I'm doing good. We'll let kids finish school, so we're on to summer break now.
Very, very nice. So any common issues as of late amongst your patients that we've seen since we've last spoke, different from the last time we talked?
I think a lot of an increase in anxiety just because people are unsure now that the state is opening up what the right move for them is right now. And so there's a lot of questioning as far as what is safe for them. And so that's been frequent conversations for me in my sessions lately.
We've also seen a lot of other issues come up. We talked a lot with Senator Jim Runestad earlier about the visitation restrictions at nursing homes and senior communities, and a toll that takes on their mental health. And also earlier on in the week, we spoke with Sally Pung, Michigan's long-term care ombudsman, about the same issue. What presents the largest mental health challenge for seniors who have been isolated inside long-term in their long-term care facilities due to the pandemic, or haven't been able to see their families in person and embrace them and so on?
I mean, I think it's fairly the same as us in terms of depression, anxiety, loneliness, boredom, trauma, grief. It's the same feelings for them, especially people who are used to being very social and now they're very isolated. They're not allowed out of their rooms or out of their apartments. And it's very depressing for them, or creating a lot of anxiety, not knowing when they're going to see their loved ones or their friends or their family members. It's creating a lot of the same feelings that we have, but it just looks a little different because of the situation that they're in versus what we're in.
And other than, we've spoken before about interacting with them via technology and talking to them through the phone. Other than that, is there anything else that they can do, or anything else that we can do as their family members, as their loved ones, to help them through that situation?
Definitely have more contact with them. One thing that people can do is they can write letters to loved ones. I'm sure that they would love to have mail and have something to do, and sending them pictures, things that we don't do anymore because, number one, you can see that you used to be able to see them in person, but they still want to know what's going on in everyone's life. So pictures. My son, one thing that he's done for some of his family, for some of our family members, is that he's made drawings for them. He's made kind of a creative hug of a person with like arms, and then we're mailing that off to people. And that's been really helpful. People are really appreciating that because they can't touch anyone. And it's very saddening for them. So just staying in contact as much as possible. Now that the weather is nicer, I think it's easier for our loved ones to maybe go out into a courtyard or just out into the parking lot and just do a social distance visit, which is a lot easier now that the weather has improved.
In nursing homes in particular, a lot of the patients that are there have already have amounting physical issues that are keeping them in the nursing home. How is their mental health connected to their physical health? Does one affect the other? And does that present any more issues as time goes by?
Yes, I mean, they probably already are dealing with depression and anxiety, and now you add isolation into that, and that's a whole nother level. So 100% physical affects mental health, and mental health affects physical. So, they're intertwined. And so probably when we call them activities of daily living, when people are no longer able to complete their activities of daily living, such as driving a car, completing their routine, taking a shower, the things that they would be able to do on their own, that increases their depression or anxiety or both. And then you add, again, like I said, add isolation into that. And so it's very important for the healthcare workers that are working with them to be aware and make sure that, kind of monitor their mental health and see how they're doing and intervene if needed.
And what sort of long-term issues can elongated loneliness and isolation have on an individual, particularly in this situation, but also just in general?
Well, depression. Depression is the main mental health issue that's going to come out of this. When things don't change, we develop what's called learned helplessness, which leads to depression. And that's when things chronically stay the same. And you may have tried to do something different and it hasn't worked, or nothing has been able to change. And so it does lead to depression. And so being able to be aware of that, and also educate our loved ones who are in nursing homes or in assisted living communities, what are the symptoms to look for? What does depression look like? What does anxiety look like? What does, grief look like? So that if they start to notice it or they start to feel it, they can reach out to somebody and let them know what's going on.
We also spoke earlier on, Melanie Schwartz with us, Dr. Melanie Schwartz from Viewpoint Psychology and Wellness with us on the Oakland County Megacast on our family of stations. Earlier on in the show, we spoke to Chief Greg Flynn from the West Bloomfield Fire Department. He's at home. He has some time off. Other firefighters in our community are taking a lot of their time off now that they weren't able to get earlier on because of the crisis that amounted and so on. But for those who have been working through this, and for those who have been having other stresses come through during this, work-related, maybe they're off work or they've been in and out of work, what should companies be providing to their employees in terms of time off or ability to rest to help them cope with these issues so that they don't have a mounting work-related stress that affects them in the office and outside of the office?
Well, they should make sure that people aren't overworking, that they're working now that things have calmed down, that they do have time off. There's not a right formula for that. It's different for everybody. People have different limits, and that's okay. But just being aware, if you're noticing that some of the fire department, police staff, police department, that they're getting burned out, or they're experiencing some of the symptoms of trauma or grief that we seem to have been experiencing, that they take some time for themselves, that they are able to spend time with their family, that they're able to regroup, because that's how they're going to get through it if we have a second wave or a third wave or whatever is coming to us in our future. So they have to be at their best. And so time off and relaxation and taking a break from the very difficult few months that we've had is going to be very important.
Another issue is in our state that's been affecting a lot of people, 340,000 people right now trying to get unemployment who have had their cases frozen because of fraud. 2.2 million people throughout the state of Michigan have either applied for or are currently on unemployment. That's a huge issue right now, and especially those who have not received a check or those who are on hold and in limbo with the state UIA because of fraud. They're also having a serious toll being taken on them. Actually, Representative Cheryl Kennedy was with us yesterday and said a lot of her constituents, and even Jim Runestad earlier on in the show said a lot of his constituents have been calling in at the peak of their stress, and some of them even have been mentioning potential of self-harm because of the financial situation that their unemployment's put in there. So my question for you, Dr. Melanie Schwartz from Viewpoint Psychology, is what can we do to help as their colleagues, as their friends, as their family, to help them through this situation mentally, so that if they're reaching that point, maybe we're able to help pull them back a little bit or point them to resources that can help them?
Definitely check in with them, see how they're doing, offer your support if you can. If they need to find additional resources that they don't know how to find, tell them that you will help them find those resources, or you will find someone who can. Just let them know that you're there, because they feel very alone and very isolated and very helpless. And so knowing that they have support will definitely help them to feel less anxious, feel more secure with the very difficult financial situation that they're in.
And for those who are at the peak of their stress, who are at that rock bottom moment and maybe don't have access to the resources they need, such as a psychologist, and because they're off work or they're out of work entirely, what resources are available to them that they would be able to access in order to help them through this situation and maybe talk with somebody?
At this point, well, I would definitely contact the community mental health centers, such as Oakland Family Services, or Easter Seals. Those are nonprofit facilities that do offer low cost therapy sessions. There's hotlines out there, such as the suicide hotline, crisis hotline, and contacting the people who work at those places, and having conversations to figure out how they can get the services that they do need. it is out there. Jewish Family Services as well, contacting them, and they will put you in touch with resources. There's definitely places in the area that will definitely work with them to get them what they need right now. The services are available. You just have to reach out, and they will make them available.
Joined by Dr. Melanie Schwartz from Viewpoint Psychology and Wellness on the Oakland County Megacast. Just a couple more minutes with you, Dr. Schwartz. Anything else that we haven't touched on that may be an issue right now that we haven't spoken about, or anything else that you'd like to say before I let you go?
Those seem to be the main issues. Just a lot more anxiety right now. And, as I've said to you guys in the past, reach out, okay? Again, whether you have the resources or you don't, reach out and we will find a way to help, okay? Because we know that mental health is extremely important right now, as important as your physical health, if not more important. And we will help get you the services that you need, whether it's just talking to someone, whether it's finding support in a different way, whether it's financial or just need someone to talk to, not even as a therapist, but just as somebody who's a buddy who you can speak with. We will be able to help that, because that's what's needed right now.
Well, thank you very much for being with us today, Dr. Schwartz.
Of course. Thank you.
Dr. Melanie Schwartz with us on the Oakland County Megacast on our family of stations. And it's a tough time for a lot of people, and a lot of really tough issues that people are working through right now that are connected to the issues that be in our general society: COVID-19, unemployment, protests going on, and some unrest in certain areas, uncertainty certainly about the future of their community, of their jobs, of their families, and of the world in general. And so it's a really tough time for people psychologically. If you need those resources, reach out. And if you know someone that's in a situation that they need some help and they could use your helping hand, or just you being there and saying, I'm here for you, definitely take the time to do that. We're going to take a short break. We'll be joined after the break by the principal founder of the Cronin law firm, Sabrina Cronin. She's going to talk to us about some other amounting issues that she's seen pop up in criminal cases and in civil cases during this pandemic crisis. That coming up on the last half hour of our Oakland County Megacast. Erica Jones is also out in the field. She's going to uncover some of the methods that local restaurants are using, some other unique methods that restaurants are using as they reopen for 50% capacity with their customers throughout the Oakland County community. I'm Tyler Kieft, back in a moment on the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast on our family of TV and radio stations. I'm Tyler Keefe. You're watching us on Civic Center TV and Birmingham Area Municipal Access. You're listening to us 89.3, Lakes FM 88.1, The Biff, and WAHS 89.5, Avondale Community Radio. We're also on the Facebook page of the West Bloomfield Fire Department today. They are our Facebook partner. Thank you very much to Chief Flynn and the entire team at the West Bloomfield Fire Department for joining us today and having us broadcast on their Facebook channel via Facebook Live for the entirety of today's program. As I said before the break, a lot of new issues have been arising during this crisis that are issues within issues. They're connected in some ways, and in some ways they're issues that have amounted from even before the crisis. And sometimes that amounts to legal action being required. And to talk about that, we are joined now by the principal founder of the Cronin Law Firm. Her name is Sabrina Cronin, and she's joining us now on the Oakland County Megacast. Sabrina, thank you for being with us.
Hi, thanks so much for having me, Tyler. I appreciate it.
Yeah. It's a pleasure. How are you? How's your team at Cronin Law Firm been throughout this pandemic?
We're great. I know it's been hard for so many people, but we picked up and did all of our work from home, and we still are, and we're servicing our clients, and we've been busier than ever, actually.
So you're continuing to work at home, as you said. A lot of businesses are reopening their offices slowly but surely, or have plans to do so in the future. Any plans to reopen the law firm in person anytime soon, or are you going to continue to do work from home for the foreseeable future?
Well, we've been servicing some of the clients that need to come in, obviously maintaining social distance, wearing masks, and of course, making sure everything's cleanly, clean, sterile. But some of the clients still need to come in to sign certain papers, get some certain documents, and some of the clients don't have access to the Zoom, capabilities at home, so they'll come into the office because court hearings are still taking place, and so we've allowed them to come in to do that. We've had some essential employees at the office, typically one or two, but we will be resuming back to normal starting in this month and going more into the following month.
With all these mounting issues, they're COVID related, they're unemployment related, they're related to other issues in people's day-to-day lives, and they all are connected in some way or another and often lead to some stressful situations where people are not at their best. And in that case, sometimes we see actions be taken that maybe are regrettable or are not the best decisions. Have you seen any uptick in any particular kinds of cases across your desk come up during this pandemic?
Yes, absolutely. More and more incidences of domestic violence and assaultive cases have come across our office. We have seen such an uptick in high conflict family law matters, domestic relations, criminal cases. And I know we've also seen that throughout our community relative to a lot of the violent protests that we've been seeing. And unfortunately, it doesn't just stop in the home. And that's what we've been seeing.
Where are a lot of these cases happening, or why are you seeing any particular reasons why a lot of these domestic violence cases are increasing during this pandemic?
Well, unfortunately, I believe it's when people are forced to be at home and staying at home and not able to get out and, kind of release some of their frustration, some anxiety, their fears, their anger. People take it out on one another, and people take it out on their families, and people don't know how to handle their emotions. And I see that oftentimes in family law matters and domestic cases. And, unfortunately, it takes a very strong mind and a strong will. I know we were just listening to the woman before me talk about mental health, and mental health is such a large part of it. And learning how to control one's emotions is a big part of that. And what I see oftentimes in our line of work is when people don't know how to handle their emotions and don't know how to get, control of it, then they let things leak out. And unfortunately, other people suffer as a result, and they suffer too.
And in these cases that this happens, and you've seen a lot of that throughout the last several months during the coronavirus pandemic, people do lash out. They don't have control of their emotions. They make decisions that frankly are stupid and are unnecessary. And in a lot of these cases, domestic violence is something that's either been built up to or has happened before, not been reported. And in some of these cases, it's a lapse of judgment. It's a moment where emotions boil over. In those kinds of cases, keeping all of that in mind, how do you navigate that and deliberate between this is a problem that needs to be mediated and this is a problem that probably needs to be taken care of in court?
Well, it depends on how often it occurs. And I always say when people's backs are pushed against the wall, that's when their true character comes out. And, people can say they want to change. Let's just say in a domestic violence situation. And, typically it's the male assaulting the female, or it's because the female has oftentimes, maybe incited the male, or that's what they think. They'll get in that person's face and, they'll point the finger and they'll just go, 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 go. And I'm not saying that there's any justification for assault. There's no justification for hitting somebody. Absolutely not. But what you see is that someone will just snap. And if it's a one-time occurrence, they can get, help and they can get, treatment for it. But if it's in someone's character that they've been doing this time and time again, it's like an addict. Unless you really work at it every single day of your life, trying to maintain, some sort of control over your own emotions, you will never be able to change. And you can only change if you truly want to change and you think you change. And a lot of times the people that do commit these assaultive crimes don't ever think it's their fault. They think it's the other person's fault. The wife who got in their face, they think it's that person's fault. They think it's, it's, COVID and the stay-home order. It's the reason, people blame other people for their own problems. And they have to look within and they have to truly want to change to effectuate any kind of positive change.
There's always factors that lead to certain decisions being made and certain actions being taken. But as you said, ultimately it comes down to you taking the action yourself and making your own decision and doing the right thing. And if it is something that is repeated, it's definitely a character issue at that point, and it has to be addressed very seriously in the cases of domestic violence, because we often see a lot of really tragic cases where this goes on for a long time, it's not addressed or it's not addressed properly, and that can lead to an even worse situation for a lot of people.
Absolutely. And, you get the courts involved when you need that intervention. Sometimes people make the mistake of calling the police when you truly don't need it, when there's no crime that has been committed. And sometimes getting the police involved in your personal affairs only does more harm than good. But when there are certain troubling acts of violence, bad behavior that is definitely criminal, you need the police intervention. You need to get the court intervention with a PPO or some sort of other restraining order, because sometimes you just can't do it alone. And typically when women are in abusive situations year after year after year, their level of tolerance gets so high that they don't even know what's reasonable, what's not, and that's why they need some help in that regard.
Moving on, we just because we have a few more minutes left with you on the show today, Sabrina Cronin, the principal founder of the Cronin Law Firm, with us on the Oakland County Megacast. Counselor, businesses are reopening, restaurants and retail this week, salons and barbers reopening next week. How can businesses reopen and provide an enjoyable service, but at the same time keep themselves legally protected and within the laws that be related to COVID-19 protections?
Well, there are certain levels of risk exposure with businesses, and the executive orders, laid out by the governor is very specific with respect to what businesses have to do to comply pursuant to the law. And we have given a lot of our business clients guidelines based upon not only those executive orders, but also OSHA and other requirements that comply with the law. And for instance, social distancing is necessary. Wearing masks is necessary. For the employment, the employer oftentimes has to supply certain PPP, the personal protection gear for their employees, whether they be masks, whether it's, necessitating hand washing, having the, different sanitizers available. And if someone is sick, then they encourage them to stay home. the sick and stay home policies are much more liberal and lenient than they ever, have been, and they need to be. So instead of encouraging a worker to come to work while they're sick, we're now encouraging them to stay home, get better, don't expose the rest of us, and, everyone will hopefully be safer as a result.
And who is responsible legally for these businesses to monitor them and to make sure that they are adhering to COVID-19 regulations?
Are you asking who's responsible for the employee to monitor that, or the employer? If a security comes in?
Yeah, if just in the general operations sense, for the employees who are coming in, for the patrons who are coming in, who overall at each of these companies and these businesses is responsible for making sure that overall they're adhering to these COVID-19 guidelines?
Well, it's the employer. The employer has to make sure if there is a policy that no one can enter those doors without wearing a mask, then it's the employer who insists. And if they don't have a mask, then they have to provide the patron or the customer with a mask. Same with an employee. If the employee doesn't have a mask and that employer is requiring them to wear a mask, which they need to, then those masks have to be provided by the employer. Similar to signs saying, you must wash your hands. We used to see it in restaurants in the lavatories where, all employees need to wash their hands. Well, those signs are going to be all over in many businesses moving forward. And I think that's a positive step, because oftentimes our country really wasn't that sanitary even before all COVID-19 took place. So we need to move in the positive direction of making sure our employees are safe, our customers are safe, and overall just maintaining that level of cleanliness and safety is better for not only that particular employer and all those employees within those walls, but the customers and our community at large.
And by and large, at least from the businesses that we've talked to, and from what Erica Jones, our reporter, has seen out in the field, as she's been traveling to different businesses throughout Oakland County as they've reopened, we've seen a couple of different cases. Either A, they've been very compliant and have even used creative means to maintain that compliance, or they have delayed their reopening to make sure that they have the best policies they can possibly put in place, and that everybody on their staff and on their team is trained to make sure that those are followed. So consequently, if there's a business that is not taking those precautions and isn't being as careful, what legally are the ramifications for a business crossing the line or simply just being lazy with COVID-19 regulations?
Well, the employees would have a cause of action if they suffer damages as a result. So let's just say someone got sick and, technically, really anyone can sue. Our legal system, our judicial system is set up where, anyone can sue for any reason at any time. Whether that cause of action sticks is another story. And you have to show damages. There's one thing, there's a two-pronged system. You have to show the negligence or the liability, but then you also have to show, did damages occur as a result of their negligence? So let's just say someone got sick, and then proving it is another reason. Is it a proximate and direct cause that this employer's failure to follow certain regulations and prevention cause this employee A to get sick? If that truly did occur and you can prove it, which is another situation because COVID is around us, all of us, all over the place. So how do you prove that they got sick in the workplace? But if you can, and there are damages that result, then of course they would be held liable.
Sabrina Cronin, the principal founder of the Cronin Law Firm, with us on the Oakland County Megacast. Before I let you go, anything else that you'd like to say or anything else that is important to bring up that we haven't touched on yet?
I just think it's important for everybody to remember to stay safe, keep your spirits high. This too shall pass, but we are entering a new normal, and we have to look at the positives of this new normal. Keep your, emotions in check. And always rely on someone if you need that extra help. Get that help if you need it. Don't take it out on, your loved ones. And just keep a positive spirit, and everything will be fine. And don't watch the news so much.
Yeah, take a break. Watch the Megacast, always. But everything else, you can take a break from the rest of the news. You get all of it here Monday through Friday, 10 a.m. to 12 noon. Sabrina Cronin, thank you very much for being with us today.
Thank you so much for having me. Have a
Yes, you too. I always appreciate it. Sabrina Cronin, the principal founder of the Cronin Law Firm, with us on the Oakland County Megacast. We have Erica Jones out in the field. We'll get to her in just a minute. We'll take a quick break and return. You're watching and listening to the Oakland County Megacast on our family of stations throughout Oakland County.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe from the Green Media Center studios in West Bloomfield, Michigan. We have Erica Jones out in the field. Restaurants have reopened all throughout Oakland County. We have her in West Bloomfield. She is at the Stage Deli. Erica Jones, how are things going out there?
Hi, good. So yeah, thanks, Tyler. Like you said, I'm at Stage Deli on Orchard Lake Road, and I'm sitting talking with the owner, Steve Goldberg. So he's going to tell us a little bit about how their reopening has been and some different things they're implementing to make sure all their customers are able to eat in a safe environment during the pandemic. So, hi, can you tell us some of the things we were talking about just with the different policies you've implemented and how that's been going for you?
Yeah, so our overall goal is to make this stage a safe and secure, healthful environment for everyone by making it as touch-free as possible. So from the moment guests walk in, we have touchless menus. They can scan a QR code on their phone to look at a menu there, so they don't have to deal with a menu. For people who don't have a phone, we have paper menus that are disposable. We have separate entrances and exits so people can stay socially distanced as they come and go. We have touch-free bathrooms. We've installed touchless sinks and door handles to reduce touching there. We have a mobile touch-free payment system at the table side, so guests don't have to hand over their credit card. They don't have to touch anything. It's really great. We separate all the responsibilities for handling soiled dishes to one staff member and clean dishes to another, so that we make sure that there's lower risk for cross-contamination. And my favorite is a new air purification system, which kills most viruses and bacteria in the air. So it's very nice indoors, and of course the outdoors is a very popular choice right now. So those, among other things, are what we're doing.
That's great. So how have your customers been responding to this? Has everyone been respectful, or what are you seeing as more and more people are coming into the restaurant?
Yeah, so throughout the quarantine, we've been open for carry-out, and people have been I hear time and time again that people come to the Stage Deli because they trust us, and it's me and my family, and so we operate with the highest integrity and really cherish that trust that guests have in us. So guests now coming back to the restaurant feel quite natural and safe, and people have been very appreciative and very cooperative. Everyone has been following rules, wearing face masks until they're seated, and appreciated the extra safety precautions that we've been taking. An additional one we're taking is to close on Mondays throughout the summer in order to do a deep cleaning every week to just make sure that whatever sanitizing can be done is being done to create a safe environment.
That's fantastic. So what is the rule specifically with the face mask? When customers come in, when are they required to be wearing it and when are they not?
Yeah, so the customer does not need to wear a face mask when they're seated and eating. Anytime they're not seated, face mask is required. Very simple.
All right, so even if they haven't gotten their food yet, when they're sitting at the table, they're not required to be wearing the mask?
Absolutely. Yeah.
Oh, yeah, that's great. And then are you seeing your numbers increase as the days go on that you're open for people to dine in?
Yeah, so we just started on Monday for Dine In, and people have been dipping their toe in the water, but each day has been getting busier and busier. And I expect this weekend will really be a true test because during this week, people have been transitioning and going back to work. And so this weekend, we'll really see how brave people are and what they're ready for. But we're here to accommodate people who are ready to come out and eat. We're here to accommodate people who aren't quite ready to have that level of exposure. And so we're continuing our curbside program, and that's still very popular.
Good. And I know we were talking a little bit about your staff. Can you tell us, how they're reacting? Have most of them felt comfortable coming back to work?
Yeah, so our staff, just like everyone else, it's a slice of the community. Some are eager and anxious and happy to come back to work. Others are have a little trepidation and are holding off a little bit. So we're happy to accommodate everyone. And right now we have a good staff, good core staff to handle all of our guest needs.
Well, that's great. It seems like things are going very well over here, and I really appreciate you taking the time to talk with us today.
Thank you so much.
Thank you.
So, Erica.
All right, Tyler, back to you.
Yeah, well, Erica, out there at the Stage Deli, Steve went through all of the different regulations they're putting in place and precautions that they're taking, people in one door and out the other, what's going on inside the restaurant, what the requirements are, the pre-screening before you go in. What have you seen? You've been there for a little while here today. How have you observed those going? Are they moving along smoothly? Do you think that people are cooperating well with them? And what have you seen be the results of that today?
Yeah, definitely. And like we just heard from the owner himself, people are definitely adhering to the guidelines that have been put in place. Everyone has on face masks, except for when they're seated. So I think things are going very well around here.
We've seen a lot of creative ways of creating barriers between tables or blocking off tables at certain restaurants. We've seen, of course, the COVID monster at the grill. We saw the COVID curtain earlier on this week at one of our local Coney Islands. Have you seen any of those kind of creative blockades or measures being taken at Steve's?
I think if we could just ask you one more thing, do you have any specific ways that you're blocking off the tables, or are you just making sure to not seat people at tables near each other?
Yeah, so we have removed and put into storage many tables, but a few of our booths, we have stacked on it cases of our Dr. Brown's cream soda and black cherry to indicate that those tables are reserved for another day.
All right, that's awesome. So there is your answer, Tyler. They are blocking off some of the tables, others they've removed, and they're making sure that people know where they can and can't be sitting.
Well, that's very interesting. It's another interesting method being used by another local restaurant in order to create some form of a blockade or a fortification there. We'll call that a COVID closure for now at the table. Not a great name. We'll come up with something better for that later on. Erica Jones, anything else from out at Steve's Deli in West Bloomfield?
I think we covered it. Everything's going well around here, and I look forward to coming in myself soon.
Wonderful. Well, thank you very much, Erica, out in the field. Erica Jones with us on the Oakland County Megacast, our field reporter out there, getting you another great report today from another restaurant as they began opening this week throughout the state of Michigan, throughout the Oakland County area. They've been open up north over the past several weeks, and Michigan's Lower Peninsula into Phase 4. Restaurants and bars reopened. Retail reopened to 50% capacity along with that. And then next week, beginning on Monday, we're going to have hair salons and barbershops also be open at the same time down in the state. Not in Phase 5 quite yet, like we're seeing up in the Upper Peninsula and regions 6 and 8, the northern Lower Peninsula and in the Upper Peninsula. But that's oncoming, and if we do this well, if we do this right, we're going to get to that point very soon and be able to come out of this and get into Phase 5 and have more things be opened and have a little bit more leeway with what we're with what we're able to do in our regular services. So Erica Jones goes there. She says that Stage Deli has their cola boxes stacked on tables to create a blockade. And I talked about earlier on in the week, we've seen some other very creative measures be taken to block certain areas of a restaurant off, to divide tables up so there's some social distancing between booths and tables. Let's take a quick look at a couple of those. On Monday, Dave Scott this week was out at the Grill in Sylvan Lake where they put up their COVID monster on tables. There's a picture on your screen if you're watching us on Civic Center TV, and you can watch this on demand at civiccentertv.com. A picture of the Grill's owner, Vicky Kirker, with one of their COVID monsters. It's smiling. It's happy to be there. It's happy that restaurants are reopened in Oakland County, but says, hey, wait a minute. Don't sit here. We're maintaining social distance between between tables. And you can also see there's a nice couple of patrons behind Vicky in this picture, sitting at the table behind her, and then another COVID monster there. So tapering off different tables. That's one of many great examples from throughout the area that we've seen lately. And then earlier on this week, Erica Jones discovered at a local Coney Island, I believe it was in Bloomfield Hills, she discovered this, the COVID curtain, putting a shower curtain at a table to close it off and say, oh, wait a minute. This table needs some privacy. It doesn't need people sitting here right now. We're maintaining social distance. Move on to the next table. Creative ways, and I'm sure there's plenty more that we haven't matched yet, we haven't seen yet. And we're going to see a lot more as we open up barbershops and we open up salons. Next week, Erica Jones will likely be going out to Frenchie's, as we mentioned earlier on a few weeks back when we talked to the owner of Frenchie's Salon, Lindsay Villasenor, on the show here on the Megacast. We'll likely be going there. We'll see what creative measures they have. We're going to see a lot of creativity, a lot of fun stuff to keep the mood light as we come out of this crisis slowly but surely. We're not quite there yet. We still need to be very vigilant about what we're doing and take those safety precautions. Wear your mask, keep your social distance, and do the right thing in all this to make sure that we're able to come out of this crisis as soon as possible and as effectively as possible, because preventing a second wave, if we go into a second wave situation, it could be a lot worse than what our first wave was as far as the restrictions. And like Governor Whitmer always has said many times before at her press conferences, we don't want to be rolling things back. Especially now that we're reopening things, rolling back is going to be that much more painful. So let's do our part. Let's do what we can. Wear our masks out in public and in the workplace when you can't maintain at least a 6-foot social distance. Maintain your social distance. And if you're not feeling well, stay home. Call into work. Let them know you're feeling under the weather. Call your doctor and do what you need to do in order to keep the community safe. We got just a couple more minutes left in the show, so I want to point you again to our great resources at civiccentertv.com. You click on Megacast, and there you can find all of our full episodes. You can watch our short clips. You can watch all the interviews if you missed a couple of them today. If you're just tuned in the last half hour, you only saw Sabrina Cronin and you only saw Erica Jones's great report from Stage Deli, you can watch all of our interviews on civiccentertv.com/megacast. And then civiccentertv.com/coronavirus. All of our biggest news stories of the day are posted there. We update this on the daily, including big stories like Governor Whitmer today extending the freeze on residential evictions for non-payment of rent through the end of June, through June 30th. That and more at civiccentertv.com/coronavirus, as well as links to links to trusted sources. My apologies, I lost my control to talk for a moment there, such as the CDC, the state of Michigan, and Oakland County. That and more on our website, civiccentertv.com, your home for coronavirus information in Oakland County, and all your resources on our Megacast family of stations. We've had an excellent show today, and we've had a lot of interesting guests with us joining us, and we thank them for being with us. Guests like Greg Flynn from the West Bloomfield Fire Department, also our Facebook partner today, joining us at the beginning of the show. Senator Jim Runestad from Michigan's 15th District with us as well in the first hour, alongside Mayor Ethan Baker of the city of Troy. And then in our second hour, of course, we thank Melanie Schwartz, Dr. Melanie Schwartz from Viewpoint Psychology and Wellness, for being with us, as well as Sabrina Cronin, the principal founder of the Cronin Law Firm, and Steve from the Stage Deli, the owner of the Stage Deli, alongside Erica Jones. Thanking my team as well, of course, Erica Jones with us out in the field every day and occasionally in here in the studio with me as well. Dave Scott, our host, who was out on assignment today. Our producer, Captain Jeff, getting our guests aligned each and every day for the show. Larry Nyland, our Zoom producer. Ryan Younglove, our production tech at Master Control, making sure we're staying on the air and everything sounds and looks good, and helping out getting those clips and interviews also onto our website, as well as our stations, 88.1 The Biff, WAHS 89.5 Avondale Community Radio, Birmingham Area Municipal Access, and all of our other partners. I'm Tyler Kieft, and that is it for the Megacast. We will see you again on Monday.